I'm John Minton, Chief Justice of Kentucky, and I want to welcome you all to this really important announcement. I'm pleased to be with this group here today, and for all of you. And I know in the crowd I see judges and clerks from around the state that are here and others, so I really appreciate those of you who've traveled to be here today to be a part of this really important announcement that we're having. This will be the launch of the new initiative that aims to improve Kentucky's courts' handling of the most entrenched problems, or one of the most entrenched problems in the Commonwealth, and that would be the opioid epidemic that's devastating the lives of and families of people all across the Commonwealth. And unfortunately, we're at the epicenter of that. It's happening here more often, more frequently, and in a greater rate than other places around the country. So I want to give the judges and the circuit court clerks and our court personnel, this will help by giving them the tools that they need and the resources that they desperately need to more effectively handle the opioid-related cases that come before our courts. I'm pleased that we're going to be able to do this through this RESTORE, which stands for, it's an acronym that stands for Responsive Education to Support Treatment in Opioid Recovery Efforts, RESTORE. The Administrative Office of the Courts is carrying out RESTORE initiative as a sub-recipient of a grant from the Substance Abuse and Mental Health Services Administration. The grant was awarded to the Kentucky Cabinet for Health and Family Services as a part of the collaborative effort with Kentucky, the Kentucky Opioid Response Effort. I want to welcome an impressive group of speakers, whom I'll introduce in a few minutes. I also want to welcome and express appreciation to my colleagues on the Supreme Court who are here to be a part of this and to show the full support of the Kentucky Supreme Court for this very important initiative. I also have mentioned earlier, but I want to call special attention because I really appreciate the judges who rearranged their dockets to be here, the circuit court clerks who are here, who travel from across the Commonwealth to be a part of this. Members of our Administrative Office of the Courts, Department of Family and Juvenile Services, because you know it's a reality that this isn't a criminal justice problem, although it is a criminal justice problem. It crosses many barriers, it crosses many lines, and it is a family court problem. So I see representatives of the family court here who on a daily basis deal with the opioid disruption of families all across the Commonwealth. So Judge Mailing, I wanted to single you out because Judge Mailing represents one of our representatives on a regional opioid initiative that we joined with Ohio and our neighboring states to try to address this in a regional basis. So I appreciate your being here, Judge Mailing. Our pretrial services department is here. Our Department of Drug or Specialty Courts who will play a key role in helping us carry out this initiative. And of course the reporters who are here to carry the story so that the message gets out across the Commonwealth. We're pleased that you're here too. Over the last 2 decades, the opioid epidemic has created a national public health crisis, ravaging communities. It has torn apart families and taken lives. Kentucky has been one of the hardest hit states with a staggering number of overdose deaths. The good news is that Kentucky's outcomes are finally beginning to improve. Opioid-related drug charges are declining, opioid-related overdose deaths are down, and access to medication-assisted treatment is up. The bad news is there's still a great deal of work to do. Last year, our state saw nearly 8,000 heroin-related charges and more than 1,000 opioid-related overdose deaths. Some counties still have limited access or no access to local medication-assisted treatment providers. And we're seeing a surge of new drugs as meth-related charges are skyrocketing in Kentucky. While the opioid epidemic has placed a severe strain on the courts, we're fortunate that our courts are in a unique position to positively impact the crisis. The decisions made at each point of contact within the justice system can profoundly affect recovery, the recovery process for each adult, young person, and families who interact with our courts. We have a duty then to understand what research puts forth as the most effective court processes, the most effective practices, interventions, and treatment models that can support lifelong recovery for those people who appear before us. Our belief in what the courts and the Commonwealth can bring to bear on this epidemic is why we're excited to bring Restore to the court system. I especially want to thank the newly formed Restore leadership team, which is comprised of circuit, family, and district judges and a circuit court clerk. The leadership team is responsible for leading this initiative and carrying out the next steps after today's news conference. After today's announcement, we have a busy year ahead of us. We'll be inviting Kentucky's judges and court staff to attend two two-day summits in 2019, one in the summer and one in the fall, which will be offered in each of Kentucky's 7 appellate districts. The Restore Summer Summit will focus on understanding the stigma and science behind opioid and substance abuse disorders. The Restore Fall Summit will focus on understanding the treatment and recovery process. These summits will give us the opportunity to discuss challenging and important topics such as understanding addiction as a disease, medication-assisted treatment, pregnant and parenting mothers with an opioid use disorder, neonatal abstinence syndrome, understanding craving and relapse, and family preservation in the context of a substance use disorder. Conversations about these topics aren't easy, but they're necessary as we equip our judges, our circuit clerks, and our staff to deal with the complex challenges surrounding addiction in the real world. We want to prepare court officials to make decisions that support recovery rather than hinder it. Our vision for Restore is that we will gain a shared understanding of substance abuse use disorders and embrace best practices in courts dealing with this disease all across the Commonwealth. Regardless of how bleak the statistics appear when it comes to the abuse of opioids and other drugs in Kentucky, we do believe that treatment and recovery are possible for individuals and for families and for communities all across the Commonwealth. And by working together, we can make a difference. So now I want you to hear from the people who are sitting around me who are going to make all of this possible. Hear for those who have seen and experienced firsthand the opioid epidemic in its various forms all across the state. So first of all, let me invite Wendy Morris, who's the Commissioner of the Department for Behavioral Health, Developmental, and Intellectual Disabilities for the Cabinet for Health and Family Services, to address you. Wendy?
Thank you. Well, good afternoon. It's my distinct pleasure to be here today and talk for just a few minutes about Restore, responsive education to support treatment in opioid recovery. As Chief Justice mentioned, this program is being funded with CORE dollars. CORE is an acronym for the Kentucky Opioid Response Effort. And those are the funds that come to our cabinet for a variety of programs. But it lends itself to a rather catchy tagline, Restore with CORE. And I think Restore in and of itself is such an appropriate acronym because that's what we want to do with those CORE dollars. We want to restore hope. We want to restore lives. We want to restore families. We want to restore communities. And that's what this program is going to help us to do. The devastating impact of the opioid epidemic is pervasive and evident across the Commonwealth, affecting Kentuckians from all walks of life. We see it in our criminal justice system, our healthcare system, our social welfare system, our workforce, and our education systems. The Cabinet for Health and Family Services is dedicated to defeating the opioid crisis and is working diligently to increase access to high-quality, evidence-based prevention, treatment, and recovery support services. In alignment with the Substance Abuse and Mental Health Services Administration, SAMHSA, we believe that prevention works, that treatment is effective, and that people can and do recover. Each of the major departments at the Cabinet plays a key role in this battle. My department, Behavioral Health, Developmental, and Intellectual Disabilities, is the state-designated substance abuse authority for Kentucky. We administer the associated block grant and general fund dollars to support infrastructure and services. Most of those dollars are allocated through contracts to our Behavioral Health Safety Network, which is made up of the 14 community mental health centers that serve all 120 counties. We also secure a number of competitive and discretionary grants every year. The Department for Public Health has a strong role with harm reduction, Narcan distribution, syringe exchange programs, and other programs that helps decrease the spread of communicable diseases. Each of those provide a point of intervention and an opportunity for linkage to treatment. The Department of Community-Based Services deals with the outcomes of broken families and traumatized children. We know that substance use is a significant risk factor for out-of-home placement, is a contributing factor in 70% of those cases. The Department of Medicaid is continuing to build a robust array of treatment options for its members and has been instrumental in removing barriers to access. We are extremely fortunate to have been awarded 2 significant grants from SAMHSA since 2017, providing close to $100 million to develop and provide services specifically targeted to address the opioid epidemic. The Department for Behavioral Health oversees the allocation of those resources, the Kentucky Opiate Response Effort, CORE, dollars, as well as monitor the outcomes of those programs it funds. We collaborate with a variety of providers and partners across the Commonwealth to help implement programs that focus on prevention, treatment, and recovery. Priority populations include those with a history of overdose, pregnant and parenting women, children, transition-age youth, family, and of course, justice-involved individuals with opiate use disorder. We know that involvement with the criminal justice system provides yet another opportunity for intervention and a pathway to treatment and recovery. When we first received these federal dollars in 2017, a Cross-Systems Advisory Council was established to help guide the state's opioid response efforts. Members of the council work in close collaboration to create and coordinate effective initiatives to tackle the crisis. Members include representatives from the major departments of the Cabinet, which I've mentioned, the Administrative Office of the Court, Justice and Public Safety Cabinet, Office of Drug Control Policy, Education and Workforce Cabinet, and of course, our Governor's Office. With the support of core funds, initiatives such as Restore can enhance efforts for successful outcomes of justice-involved individuals with opiate use disorder. The program will deliver a training curriculum especially tailored for Kentucky to help educate and provide resources to our Kentucky judiciary and court personnel. Department for Community-Based Services implementing a similar initiative where all service providers will be trained with that same curriculum. So both our child welfare and our criminal justice systems are going to be better equipped as they work together to serve individuals and families affected by the opiate use disorder epidemic. This is going to result in increased access to necessary treatment and recovery supports. Restore is a wonderful example of the collaborative effort that we value as a cabinet and consider vital in our fight to effectively address the opioid crisis in the state of Kentucky. And so on behalf of the cabinet, I would like to applaud Chief Justice Mitten, Director Dudgeon, and others at AOC for their overwhelming interest and enthusiasm and for being active comrades in this battle we are all fighting. We are thrilled to support Restore with CORE. Thank you.
Thank you, Wendy. To provide a further Kentucky perspective on this, Van Ingram is here, Executive Director of the Kentucky Office of Drug Control Policy from the Justice and Public Safety Cabinet. with Dr. Brenzel and others. We have been on panels before the Kentucky Bar Association and others. So I know that there are at least two other people here who can speak very authoritatively about the Kentucky perspective. Van?
Thank you, Chief. And on behalf of Secretary John Tilley of the Justice Cabinet, thanks for having us here today. Secretary Tilley would like to be with us, but his schedule is crazier than mine, so he's always on the run. As has been alluded to, this is the worst drug epidemic our country has ever seen. And our state was really at the forefront of the ground zero of all of it. Our jails and prisons are full, over than full. In many communities, our emergency departments, our first responders, our courts, everyone is overwhelmed as it relates to this issue. Our foster care system is at all-time record high of young children in foster care, largely in part to this epidemic. It's been a long fight, but we're starting to see some progress. And it's really because of these kind of collaborations. We don't just work across the executive branch. We're in Kentucky, and I hear this as I travel the country. You people in Kentucky got it figured out. You work across, not just across agencies, but across judicial branch and the legislative branch to address this issue. And we've done it for a number of years. Restore is a great program, but it's not new for collaboration. We've been collaborating for a long time on a host of different issues, as the Chief alluded to. Dr. Brenzel and I have been on a road show and met with judges and talked with judges and went to drug court graduations and all kinds of things to cement that collaborative approach. Our good friend Nancy, what is it Congressman Rogers says? A vision without funding is really a hallucination. For a long time, we were hallucinating in Kentucky because we didn't have any funds to address this issue. Thank God now our Congress has recognized the issue and realized that we cannot ever defeat this problem without funding. The funding that's in place with the core dollars, with Commissioner Morris and Dr. Brenzel and the team they put together is making a difference in Kentucky and is going to continue to. We have more treatment availability than we've ever had. We've worked hard to remove the barriers to treatment like transportation and cost. And we have many new programs coming on board to help even further with that. Working with Nancy and Operation Unite, we've got a call center staffed with social workers that can help people guide through this bureaucracy of substance abuse treatment. We've put together a website with the University of Kentucky and the Kentucky Injury Prevention Research Center where you can find an available treatment slot within about 3 or 4 clicks of a mouse. And we're starting to see the benefits of this. We had less emergency department overdose visits in 2018 than the year prior. We had less hospitalizations than the year prior. As a state, we dispensed over 35,000 Narcan kits here in Kentucky in 2018. And the deaths that when I release a report here later this summer, we're going to see for the first time in 15 years overdose deaths declining in Kentucky at a time when many states are seeing significant increases. So I feel like we're starting to turn the corner on this epidemic, but as the Chief alluded to, there's lots more work to be done. And we're going to continue that fight, and we're going to continue to do the hard work and make sure that the dollars that are entrusted to us, that we're stewards of, that we make good decisions with those. I mentioned the federal dollars, but I'd be remiss if I didn't mention Governor Bevan and the General Assembly providing over $40 million to my office to help deal with these issues. And Commissioner Morris and her team and I collaborate every week to make sure the dollars we spend complement each other and we're all rowing in the same direction and not duplicating efforts. So we're going to continue to do those things. I'm upbeat. I think we're headed in the right direction. I think things are going to improve, and this Restore program is another example of that, of helping our judges and our courts to make good decisions as it relates to those suffering with substance use disorder. So thank you. Appreciate it for being here.
Thank you, Van. For the community perspective, we've invited Nancy Hale, President and CEO of Operation Unite, to make comments. Nancy?
Good afternoon. My name is Nancy Hale. I am an educator. I am the mother of a son in long-term recovery, and I am the president and CEO of Operation Unite. Unite stands for Unlawful Narcotics Investigations, Treatment, and Education. And for 16 years, we have been on the front lines fighting the battle in southern and eastern Kentucky in 32 counties. This public health epidemic is destroying families, crippling communities, and hampering future generations across our Commonwealth. All of you have seen the scary statistics. You've read the horrifying headlines. Drug overdoses have caused more U.S. deaths than all wars from the start of the 20th century through the present time. Every day, more than 130 people in the United States die after overdosing on opioids. 20 million people need substance abuse treatment. Only 4 million people receive it. And in Kentucky, there were 1,565 fatal overdoses in 2017. Those are just a handful of numbers. Virtually every Kentucky family and every Kentucky community has a story. But even if you do not, here's another reason why everyone must fill a role in battling this epidemic. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including the cost of health care, lost productivity, addiction treatment, and criminal justice involvement. That's a lot of doom and gloom. But I'm here today to tell you that we are creating hope and changing the culture, and what you are doing here today will be another significant step toward that effort. The criminal justice system serves an important role, but no longer exclusively in removing drugs and drug dealers from the streets, because we cannot arrest our way out of this epidemic. That's another one of Congressman Rogers' favorite sayings. Unite is working with the Kentucky State Police on the Angel Initiative, which helps people before they reach the justice system. A person with a substance use disorder can voluntarily walk into a state police post and ask for help. If they do not have any criminal charges pending, they will be paired with a volunteer angel who guides them through the process of obtaining treatment. 85 people have benefited from the Angel Initiative. Drug courts are another important tool. Every county in the Unite service area has a drug court. Participants receive the treatment and the education they need to return to the community as productive family members, employees, and citizens. Drug courts in our region have helped collect more than $2.5 million in fines, restitution, and child support. But the impact is even more powerful. Let me put a face to those statistics. Jennifer Cromer had been abusing drugs and alcohol for more than 16 years. In her mugshot on January 19, 2014, she weighed 97 pounds. 5 months later, she overdosed and was left for dead. Many people had given up on her, but not the judge, who ordered Jennifer to 90 days in a treatment facility with a Unite voucher. Today, she has rebuilt relationships with her family and daughters and is a productive member of the community, my home community. We also cannot forget our youngest victims. There are 26,296 homeless students in Kentucky. To put that in perspective, those students would fill up 370 school buses. That number is about 4% of the total student population in Kentucky, but in some counties it is much higher. For example, Harlan County ranks second only to Jefferson County in the number of homeless students. Its 1,111 homeless students is slightly more than the number in Fayette County, even though that school system is 10 times larger. Why? Because 90% of those parents are in jail or incapacitated by drugs. There are also 96,000 children in foster care or relative care, and more than 60% of that total stems from drug abuse in the home. That's why Unite's prevention initiatives include mentoring and nurturing components that guide youth away from destructive choices, many of which they have witnessed firsthand at home. We can turn these statistics into success stories, and Restore will help us do that. But Unite's holistic approach to tackle this challenge at the local level has caught the eye of national leaders in Washington, in large part due to the championship of my good friend, Representative Hal Rogers. The congressman recognized these issues in our region early on and tried for many years to toll the alarm bells in Congress that this could evolve into a national crisis. While it is unfortunate that his premonition has become a sad reality for too many families across the country, we are fortunate that Congress has finally heeded his warning and is willing to embrace the same multi-pronged attack on addiction that has been a model for success here in Kentucky. There is not a lot of bipartisan consensus in Washington these days, but when it comes to opioid abuse and addiction, our leaders agree. We need decisive action, and we need it now. While so many of the solutions to this crisis can and should be community-driven, the federal government has two major tools at its disposal to be the change we so desperately need: the power of the purse and the power to effect policy change. And Congressman Rogers has been at the tip of the spear in both of these respects. When he chaired the House Appropriations Committee, he worked hard to target federal funds on programs that will actually work in our communities. Today, there are 57 federal programs across 5 departments and multiple agencies, including the White House Office of National Drug Control Policy, that either entirely or significantly fund efforts on the state level to tackle the epidemic. Both the Congress and the administration have embraced federal programs to tackle the problem from every angle: law enforcement, treatment, prevention, recovery, and research. And we're now spending nearly $10 billion each year in these areas. Congressman Rogers and his colleagues have placed a particular emphasis on federal support for drug courts. This year's spending bills include $77 million for drug courts at the Department of Justice and $89 million in the Department of Health and Human Services to support nonviolent offenders in their recovery. An additional $22 million is included for veterans treatment courts to help our men and women in uniform who are struggling with addiction. Offender reentry and research activities under the Second Chance Act are also funded at $87.5 million. I have attended many drug court graduations and listened to the heartfelt testimonies of those in recovery who have been reunited with family, found a stable job, or advanced their education or job skills. When they realize the judges are volunteering their time, it makes a huge impact on their personal lives. Congress has also been working in a piecemeal approach to change the policies that have led us to this point. While there are true human impacts of the opioid crisis, it is also taking a toll on our national economy and our health. For example, the crisis has cost the U.S. economy more than $700 billion in lost work hours. Nearly 1 million prime-aged adults are not in the labor force due to opioids. And for the first time since the 1960s, life expectancy in our country has fallen for 3 straight years to 78.6 years, due in no small part to a surge in the rate of drug overdose deaths, largely driven by opioids. In response, last October, Congress passed and the President signed the SUPPORT Act into law, Substance Use Disorder Prevention that Promotes Opioid Recovery and Treatment for Patients and Communities Act. They love acronyms. This bipartisan bill aims to advance treatment and recovery initiatives, improve prevention, and bolster our efforts to fight deadly illicit synthetic drugs like fentanyl. So while this is a crisis that demands local solutions, our leaders in Washington are listening to us and working hard to implement the policies we need for success. We can change those statistics into success, and RESTORE is a beautiful acronym for doing exactly that. Thank you.
Family Court Judge Janie McKenzie Wells of the 24th Judicial Circuit is a member of our Restore leadership team. Janie?
Thanks to all of you, and I thank the Chief and everyone on this panel for being invited to speak. I wanted to give you a little bit more of a community perspective on how we have dealt with it in my communities. As the Chief said, I'm a member of the Restore leadership team, and there are 8 other judges that are also on that team. These include not only family court judges, but circuit court judges, district court judges, as well as many of the AOC staff who are dedicating their time to help fight this crisis. As the Chief and others has told you, the goal of this initiative is to provide training and resources to the court system, and specifically to the judges in the court system, to further address Kentucky's opioid epidemic, which is pervasive on all of our regular dockets, whether you are a family court judge, a circuit court judge, or a district court judge. In fact, when I was putting together something to say, I couldn't think of a week that had gone by that I didn't deal with the removal of a newborn child that was exhibiting withdrawal symptoms. And this was usually due to the mother's active addiction during pregnancy. And I deal with that every week. The education piece of Restore will include information and discussion among the judges and others that will face this crisis in the court system, aimed at giving us an understanding of substance use disorders and more treating them like a disease. The treatment and recovery piece will include information and discussion among the judges and others in the system, aimed at a general awareness of the treatment opportunities and options available in the various communities. A few years ago in Johnson County, we began what we call the Johnson County Community of Hope, and we named it that, the Community of Hope. It was conceived with the financial and directional aid of the Casey Family Programs, which some of you are very familiar with. The mission of the Johnson County Community of Hope has been to utilize the compassion, the skills, and the resources of our community to strengthen families and to improve families and children well-being. This program has resulted in a lot of collaboration, including the Unite, who has been a big part of that. We've had collaboration among community leaders, business leaders, treatment providers, school superintendents, school principals, school resource officers, law enforcement, the local medical center, and the Cabinet for Health and Family Services. I told them when they first started, they invited me because they said if I send a letter out, people will show up, and they were afraid they wouldn't come if I didn't send it, so that's why they came. But the long-term goal of this program has been to address substance abuse involving families that are part of the family court system, and to safely return children or to obtain permanency for them, which is very important in a child's life. The Johnson County Community of Hope provides counseling, assessments, drug screens, and one of the most popular things has been gas cards, because a lot of times travel and transportation is just a big impediment. Parenting classes, and any other things that we can bring together as a community. I told them, I said, when we were sitting at the table and talking about all the resources that we had, I'm like, I didn't know we had this. I didn't know we had this. So we all sit down at the same table, and we came to know that we can help each other in ways we never thought about. Likewise, the Restore initiative is aimed at supplying courts with evidence-based best practices, and that's very important that we use that, to assist the judges in making informed decisions in these cases that involve substance use disorders. Our goal is to develop action plans, and at these summits that we're going to have later this year, to find implementation tools to support, as has been talked about today, lifelong recovery for the families in the various regions of our state. It's very evident that what works in Eastern Kentucky may not work in Western Kentucky, it may not work in Central Kentucky, it may not work in any other part of the state, and vice versa. So we need to educate ourselves on these disorders, as to the effects of these disorders, sometimes devastating. You've heard them talking about the number of overdoses, the number of deaths from overdoses, and the treatment options that are available in the various communities. In addition to accepted medical treatment, the Johnson County Community of Hope has provided a family mentor for each person in the program, as well as a job coach. And this helps the families to combat the stigma of addiction. I could think of nothing more frustrating to someone who went through this program, did everything asked of them by the court system, did everything asked of them by the cabinet, only to be denied housing or to be denied employment because they have a history of addiction. The job coach helps them to seek out the landlords and the employers who will give them a second chance. And they are out there. In fact, the owner of our local McDonald's restaurant received a Casey Foundation award for his efforts in this area and for employing those who had a history of addiction, one of which is now manager of his restaurant. Furthermore, I've read many studies myself that indicate to break a bad habit, you have to replace it with a good habit. So a vital member of the Johnson County Community of Hope has been the public library. They've offered life skills classes such as cooking and knitting and balancing checkbooks and basic computer skills. When I read this, I thought I probably should take some of that myself. But they've offered all of that to the Johnson County Community of Hope participants. Now, Community of Hope has been a voluntary program, so we don't make anybody go. Now, I may order some of the same things for these people to undergo that are in court, such as drug screens and other things. But if they volunteer for this program, I got some records from them before I came. 22 families volunteered for the program in 2018, and 21 children were returned to the custody of their parents due to success in this program. And you may say that sounds kind of low, but you know, if I can help anybody, I'm going to do it. And we're going to do what we need to do as a community. Plus, over the last few years, 119 children have achieved permanency, and these have been families that have been involved in the program. We've now expanded to Martin County, which is a much more rural county, and we're just beginning to see how it's going to have an effect over there. But so far, it's looking pretty good. I often state that whether or not you personally have dealt with substance use disorders or addiction, or a member of your family has done so, these individuals, they live in your community. They occupy the same roads that you travel every day. And more importantly, the same roads your teenage children travel every day. Their children attend the same schools that your children attend. So I'm always explaining to people, this is a community problem. So let's work on the solution as a community, and I think that's what Restore is aimed at. Thank you.
Thank you, Judge. And finally, for the individual perspective, we've invited Sharon Adams, who's the Medical Surgical Unit Director at St. Joe, London, and a drug court graduate.
Hello. So when people look at me today, they see someone who is an accomplished professional, have children who are successful in their own rights. But if they had seen me in 2005, they would have been looking at a very different individual. I was addicted to drugs, and I was enslaved to addiction. I spent every waking moment either using drugs or trying to get more drugs. And that would make somebody ask, how did I get there? So when I reflect back on my childhood, there were no indicators that I would be a drug addict one day. I was raised in a loving household, and I was safe and secure. My early adult years were uneventful. No traumatic events occurred. I was married, had 2 children, later divorced, and remarried to my wonderful husband now, Dean. And my addiction began innocently by I started having pain in my left arm and leg, and I went to my physician, and he prescribed me Lortab. He did many tests over the years. This went on for quite some time. And somewhere along the line, the switch flipped, and I became dependent and then addicted to the drug. It was no longer a medication, it was a drug for me. This ended up with me. I was a nurse at that time, and so I ended up in the restroom at work shooting up Demerol while taking care of critically ill patients. I'd become someone who was unrecognizable to myself. Finally, my supervisor became suspicious and asked me what was going on with me because my behavior was different. and I admitted that I'd been doing addicted to drugs, and I would like to say that was the end of the story, that it went well from that point on. However, as many of you know, if you've dealt with anyone in addiction, that is not the case most times. So I still believe that I had to have the medication for my pain in my arm and leg. And I was admitted to the CARE program through the Kentucky Board of Nursing, which is a program for nurses who suffer with substance use disorder. And also I told my physician who'd been prescribing the pain medication that, hey, I've been caught shooting up drugs. And he said, that's okay, you can still take your Lortab. So there was a bit of a disconnect there, and he didn't do it to harm me, he did it to try to help me, but that behavior does unfortunately impact those who are in addiction. So at that point I stopped. I didn't use the IV medication anymore, but my focus was on the Lortab. So I would take 15 to 20 a day just to maintain, and I was working as a nurse in a critical care area at that time, unfortunately, and I was still medication from my employer and my patients. And so of course my prescription was only for $90 a month, and that didn't feed my addiction. So I stole DEA numbers from the physicians that I worked with and began calling in prescriptions illegally to local pharmacies. And all bad things thankfully come to an end. So one day I went to the pharmacy to pick up the prescriptions that I'd called in, and the pharmacist had become suspicious, and he had called the physician, and then they later called the DEA. So then I had to go home that day and have the most difficult conversation of my life, was to tell my family, including my 16-year-old son, what I had become. And so we thought I'd never been in any legal trouble, so we expected the police to swoop in at any moment, and raid us, and I would go to jail for the rest of my life. But that is not how the legal system works. So the following day, this occurred on a Thursday, and on Friday I went to detox, and on Monday I left, and then the following Sunday I went to church and gave my life to Jesus, and finally the compulsion stopped, and I had a bit of freedom that I'd been seeking for many years. And so we waited a while for the charges to be filed, because again, law and order is very deceiving. Everything does not happen in an hour and be nicely wrapped up. So in October of that year, they were filed, and I had over 40 felony counts for calling in the prescriptions illegally. And I'd never been in any legal trouble before, but the prosecutor was adamant that I was going to go to prison. And so that caused a lot of discussion between him and my attorney. And then finally he relented and said, okay, she's not going to prison, but she will never practice nursing again. And so that caused several more months of discussion. And finally in June of 2006, I pled guilty to one felony, received 3 years probation and 5 years in the CARE program through the Board of Nursing, and then 18 months of drug court. And I went to work as a nurse again in a different facility. And I also had a change in perspective, which was one of the most important things. Throughout my years of nursing, I'd worked in the emergency department for some time, and I saw those suffering with substance use disorders would come in, and they would waste my time. They were hopeless, and they got what they deserved, and I really had no compassion for them. But that had changed through my addiction and recovery. And so what I want you guys to take away from my story is that drug addicts do not have to be a lost cause. If it were not for the drugs, many of them would not even be in the justice system, just as I wouldn't have been. And once the addiction is treated, the criminal behaviors will cease. And that's why alternative sentencing is so important. Drug court, instead of incarceration, can help this group of people become productive members of society. And if given the chance, many will be the neighbors and church members and friends that we all want in our lives. But they do have to be given the opportunity and empowered with the tools needed to be successful. And people do recover, and I'm proof of that. So in 2008, with the tools that I received throughout my time in drug court, and with the support of my family and friends and my restoration from the Lord, this lost cause returned to work at the facility from which I was terminated. And in 2012, I was promoted to a supervisory role. In 2014, I received my master's degree in nursing leadership. And now I'm currently the medical surgical director at St. Joseph London with over 80 staff members reporting to me. And I am an adjunct professor at the University of the Cumberlands. And had I ended up in prison, none of this would have been possible. So, thank you.
Shannon, congratulations on what you've done in your life. We are available, I'll just pass the microphone around, I'll sort of MC it, but we're available for questions if there are questions relating to the Restore effort.
I have a question.
Yes.
Hi, I write for Kentucky Health News. So I've heard Secretary Tilly speak sometime about the disparity between one part of the state and another as far as how addicts are, people with addictions who are go through the court system. You know, they get, depending on the judge's knowledge and the access to resources, you know, you might be treated completely differently. So it seems like this program is very much an education program. Will there be any sort of, each judge works autonomously, so will there be a nudging or some sort of suggestions that outcomes be different as far as what the...
I appreciate your choice of words there. Janie, you want to address that? I'm going to let a judge tell you what...
Well, if the chief makes a suggestion, we usually take it. But I think we have to individualize it, because if we don't, I think we may be just spinning our wheels. So when we have our conferences, our summits, I think that we have judges from Western Kentucky, judges from Eastern Kentucky that are on the panel, judges from Central Kentucky. We have an input on what we're going to present and how we're going to present it. And I think we can address a lot of what you're talking about with those presentations. We want to get some local people involved. We want local people to do the presentations for us. I intend in Pikeville to try to get somebody from like our community of hope to come and tell them what they're doing. That may work in another county. In Central Kentucky, they may need more people from drug court. In Northern Kentucky, the same there. But obviously you have to buy into this program. And part of the educational piece, which will be the first summit, is to sell this program. Is to sell what we're doing to the judges and to the staff.
And just from my understanding, are all family drug court judges, are they all on here? Is that?
All the drug court judges across the Commonwealth, all across the Commonwealth, are volunteers. They get no extra money to do what they do, and so they make the time over lunch hours or in the evenings or however they can make arrangements in their docket to do the extra work. And most of them do it for the very reason that Janie said she did it, because they care.
And also, they have big parties for them for the graduation, and they'll bring back, some graduates, and you hear stories just like we heard today. Everyone that makes it, drug court's hard. So if they come into family court and they're in drug court through a criminal charge or a potential criminal charge, then I let that stand, the work that they're doing in the drug court systems, because there's just a lot of work they have to do. They have to not only do the drug test, they have to find housing, they have to find employment. There are people that assist them with that, but, it's just so rewarding. It's rewarding, so the judges love doing it. They do.
Other questions? Well, thank you all for being here. I look forward to hearing and seeing more from the Restore efforts. Thank you.